So our last visit, I know we performed a routine pap smear and found some abnormal cells, which we call low-grade squamous intraepithelial lesions. I know that's a lot to take in, but they just often reflect an acute infection called human papillomavirus, or HPV. Have you ever heard of that before?
I think so. I think one of my friends has that. Does that mean I have cancer?
You know, usually the low-grade changes, such as yours, are not necessarily precancerous. About 80% of Americans, usually one time in their lifetime, will have HPV. And only about 10% of these even progress on to anything more high grade or cancerous. And that's usually such a slow process, taking over more than 5 years. So that's why we bring you in every 5 years to just do a regular routine pap smear, as well as to check for your HPV status. So we're hoping to really catch that before it becomes anything more serious.
Right, okay. So does this mean that I will have this for forever?
You know, not necessarily. Fortunately, as I mentioned, like usually your body immune system actually combats it, and it's able to clear it on its own.
Okay, great. Is there anything that I could have done to prevent this?
You know, there are now vaccines. One is called Gardasil that they provide to women or girls from 9 to 26 years old, and then to boys 9 to 21 years old. So it's a series of vaccines that now can help prevent that.
Okay, awesome. So is there any way to test my partner for this?
You know, unfortunately, there is no test for males currently, and which is a shame because it can lead to penile cancer, although this is a very rare form of cancer.
Oh, wow, okay. Is there any chance that it can come back?
You know, it's been seen that high risk ones or high grade forms of HPV can reoccur, but for the most part, they usually do not, because as we mentioned, your body kind of clears it out. Some researchers are saying it can remain dormant within your cells, and so when your immune system kind of drops, that it can come back in that respect. There's also different forms of HPV, so we always just kind of recommend to get the vaccine, and if you're out of that range, just to continue practicing safe sex with using condoms, staying healthy, and not smoking, and seeing your doctor regularly.
Yeah, I'll definitely try that. So what do we do now?
So today with that, we're going to do a colposcopy, which is similar to a pap smear, but this time I'm going to be using a microscope. And with that, I'm just going to be taking a look, and if I see any abnormal areas, I'm going to take a biopsy or a little bit of tissue sample. And then we'll send that to the labs, and if anything comes back abnormal, I'll let you know, and we can kind of go from there.
Okay.
Do you have any more questions?
No, I think you've covered it all. Thank you.
Great, thank you.
All right.